Have you ever stopped to consider how public health messages impact your daily decisions? It's something most of us take for granted, yet these messages are everywhere, subtly guiding our choices for healthier lifestyles. Public health messages, those nuggets of wisdom that promote health and well-being, play a crucial role in our lives. They're not just billboards encouraging us to eat our 5 a day or TV spots reminding us to wash our hands. They're much more than that. These messages are the threads that weave the fabric of a healthy society. They are the whispers that nudge us towards better decisions, not just for ourselves, but for our communities too. They're like the unseen conductors of an orchestra, harmonizing the melody of health and well-being at an individual, group and community level. Yet the power of these messages lies not in their ubiquity, but in their relevance. A public health message is only as powerful as its ability to resonate with its audience. This is where the art of communication comes into play. Whether it's a complex message about the latest medical research or simple advice on nutrition, the challenge is to make it relevant and meaningful to everyone. This includes people from a wide range of backgrounds, professionals from various sectors, and citizens of diverse cultures. Consistent and helpful communications are the keys to making local services more understandable and accessible. It's about removing barriers, breaking down complex jargon into simple language, and reaching out to people in ways that make sense to them. But it's not just about talking, it's also about listening and facilitating dialogue. It's about creating connections and networks between people, communities, and service providers. These bridges of communication can make access to services easier and improve their provision. Public health messages are more than words. They're the embodiment of compassion and empathy. They're the collective effort of a society to look after its own. So the next time you come across a public health message, take a moment to consider its power. Public health messages, when communicated effectively, have the potential to shape societies and transform lives. Let's delve into the story of Jane, a woman who changed her life thanks to clear public health messaging. Jane was an ordinary woman, much like you and me, but she had one vice that plagued her. She was a heavy smoker. She had tried to quit multiple times, using every method she could find, but to no avail. She was trapped in a cycle, one that was not only harmful to her health, but was also affecting her family and those around her. Then one day, she came across a public health campaign. This wasn't like the other messages she'd seen before. It wasn't filled with medical jargon she couldn't understand. Instead, it was simple and clear. It spoke directly to her, addressing her fears and struggles. It made the dangers of smoking tangible and the benefits of quitting smoking real and achievable. The campaign didn't just throw facts and figures at her. Instead, it provided her with meaningful information and tools to help her quit. It connected her with professionals from different sectors, people who could guide her in her journey. More importantly, it treated her as part of a community, not just a statistic. She was not alone in her struggle. There were others like her, and together they could overcome their shared challenges. Jane took the first step. She reached out to the services provided by the campaign. She found that they were easy to understand and access. They welcomed her, embraced her struggles, and offered her the help she needed. She experienced firsthand how effective communication could facilitate better connections and networks, making her journey to quit smoking easier. Jane is now smoke-free, she's healthier, happier, and more connected with her community. She's become an advocate, sharing her story to inspire others and promote the importance of well-communicated public health messages. Jane's story is a testament to the power of clear and consistent public health messages. Her transformation shows that when public health messages are communicated effectively, embracing a wide range of backgrounds and promoting collaboration, they can truly change lives. And that is the power of public health messaging, the power to change and save lives, one person, one community at a time. Public health messages not only transform individuals but whole communities. Let us take you to a small town that experienced a remarkable transformation. This tale begins in a modest community nestled in a rural landscape where the simple joys of rural life were overshadowed by health challenges. For generations, this community had struggled with issues related to clean water and sanitation. The impact was evident in the quality of life and the overall well-being of the residents. Then a public health campaign was introduced, one that was carefully tailored to speak directly to the community in a language and context they could relate to. The campaign was designed not just to inform, but to engage, to inspire action and change. The messages weren't complex or filled with medical jargon. They were simple, clear, and relevant, focused on the importance of clean water and proper sanitation. These messages were delivered through various platforms, from town hall meetings to local radio broadcasts, even through engaging visuals painted on community walls. This wasn't a one-way discourse. The campaign was interactive, encouraging feedback, questions and suggestions from the community, professionals from different sectors and citizens from different cultures were engaged, fostering a sense of unity and shared purpose. The transformation didn't happen overnight. It was a gradual process, but the change was profound. As the community began to understand and adopt the health messages, they started to see improvements. Illnesses related to water and sanitation issues began to decrease. The general health of the community improved, and with it, their quality of life. The campaign also facilitated better communication and collaboration between the community and local service providers. It made local services easier to understand and access, and fostered stronger connections between everyone involved. This is the power of effective public health messaging. It's not just about disseminating information. It's about fostering understanding, inspiring action, and promoting health and well-being at a community level. Indeed, when communities are armed with the right information, they can achieve great things. Healthcare professionals play a pivotal role in communicating these life-changing messages. These individuals, with their vast knowledge and experience, are key in crafting public health messages that resonate with individuals, groups, and communities. It's not just about transmitting facts and figures, it's about reaching out, connecting, and making complex health information understandable and relevant to everyone. To put it simply, healthcare professionals are translators, converting medical jargon into language that is easily digestible for all. Their responsibilities go beyond their immediate sector. They have to effectively communicate with a diverse range of individuals, from other professionals in different fields to citizens of various cultural backgrounds. This requires a blend of cultural competency, empathy, and respect for diversity. But the role of a healthcare professional in public health messaging doesn't stop there. They also facilitate the understanding and accessibility of local health services. They are the guides helping individuals navigate the often complex and confusing world of healthcare, breaking down barriers and making these services more approachable. Moreover, healthcare professionals are the bridging elements between people, communities, and service providers. They foster communication and collaboration, creating networks and connections that ensure easier access and better provision of health services. They are the architects of a more integrated and efficient healthcare system. The task is not simple. It requires a diverse set of skills, from clear and effective communication to a deep understanding of the communities they serve, from empathy and compassion to an unwavering commitment to promoting health and well-being. These are the attributes that make healthcare professionals indispensable in the realm of public health messaging. Remember, it's not just about information transmission, but transformation. The goal is not to simply inform, but to inspire change, to motivate action, to foster healthier lifestyles and communities. And healthcare professionals stand at the forefront of this mission to promote health and well-being through clear public health messaging. Communication and collaboration are key to making these public health messages reach far and wide. Imagine a world where every individual understands the importance of their health, where communities are empowered to make positive health decisions, and where service providers are in tune with the needs of those they serve. This isn't a far-off dream, it's a reality that can be achieved through effective communication and collaboration. Communication is not just about conveying a message, it's about making that message relevant and meaningful to its recipients. When we tailor public health messages to suit different audiences, we make them more accessible and impactful. This could mean presenting information in a variety of languages or using relatable examples to explain complex health concepts. The goal is to ensure that everyone, regardless of their background, can understand and benefit from these messages. Collaboration, on the other hand, is about creating connections and networks that support better health outcomes. This involves individuals, communities, and service providers working together for a common goal. When a community collaborates with service providers, for example, local services become easier to understand and access. People are more likely to use these services, and as a result, the overall health of the community improves. But it's not just about improving access to services. Collaboration also fosters a sense of shared responsibility and ownership. When individuals feel that they are part of the solution, they are more likely to take proactive steps towards their own health and well-being. Effective communication and collaboration are therefore essential tools in promoting health and well-being. But remember, these are not one-off events, but ongoing processes. They require constant effort, adaptation, and empathy, and they are worth every bit of that effort. So let's strive to communicate better, to understand and be understood. Let's build bridges, not walls, and work together for the health and well-being of all, because at the end of the day, health is a shared responsibility, and we are all in this together. When we work together, we can communicate more effectively and promote health and well-being on a larger scale. At the heart of all public health messaging is compassion and empathy. This is not just a nice sentiment, but a powerful tool in our communication arsenal. Imagine for a moment a world where public health messages are cold, clinical, and devoid of any human touch. Not only would they be uninteresting, but they would also fail to inspire the necessary action. People respond to emotions, to stories, to a sense of shared humanity. And that's where compassion and empathy come into play. Compassion is putting ourselves in another's shoes, understanding their struggles and their needs. Empathy is feeling their pain, their fear, their hope. When we infuse our messages with these elements, we are not just giving information, we're connecting with our audience on a deeper, more personal level. This connection makes our messages more relatable, more impactful, and ultimately more effective. Take, for example, the public health message about the dangers of smoking. A simple list of statistics and health risks might make some people think twice, but it fails to truly resonate with many. Now, contrast this with a message that tells a story of a father who smoked all his life, who now struggles to play with his children because of his failing lungs. This is a message that touches the heart, that stirs the emotions, that makes the dangers of smoking a personal reality. This is the power of compassion and empathy. But compassion and empathy are not just for the audience, they're also for us, the communicators. They remind us that we're not just dealing with statistics or faceless masses, but with real people, with real lives. They help us craft messages that are not just informative, but also caring, supportive, and encouraging. They help us remember that our ultimate goal is not just to inform, but to promote health and well-being. And so let us remember the compassion factor. Let us remember to put a human face to our public health messages. Let us remember to speak not just to the mind, but also to the heart. With compassion and empathy, public health messages can truly resonate and make a difference. Public health messages have the power to transform lives and communities. Through the stories we've shared today, we've seen how Jane's life was impacted by these messages and how an entire community can evolve. The role of healthcare professionals becomes crucial in communicating these messages, understanding the diverse backgrounds of individuals and communities, and making these services easily accessible. Effective communication and collaboration between individuals, communities, and service providers create networks that support easier access and better provision. The compassion factor cannot be underestimated. It's the driving force behind our efforts to communicate health messages and promote well-being. But remember, these messages are not just for healthcare professionals. They're for all of us. Each of us has a part to play in spreading these messages and promoting health and well-being. The next time you come across a public health message, remember its power and potential to change lives. Together we can make a healthier world.